I'm in my mid-50s now, and I'm at that point in my life where I need to think about my health in perhaps ways I haven't done before. As part of working at Pall, all our employees get a complimentary health screen annually, and mine came up, and I kept telling myself that I'm fine. I've never been ill for a day in my life, never had a problem, but I thought I might as well go for it. And I went along to see Dr. Tang, who's our lead GP and our clinical director. We did all our tests, he took my blood tests, and I thought nothing of it. And I got the results back a couple of days later, and within it, Dr. Tang in his follow-up call said, "Stephen, I've got some news for you. You're actually at high risk of both a stroke and a heart attack." From there, Dr. Tang recommended that I go for an MRI scan of my brain just to check for the stroke risk, and he also recommended I go for a CT calcium score. Now the MRI scan diagnosed that fortunately the initial diagnosis was misfounded and there was no risk of me having a stroke, touch wood of course still, and that there was nothing going on wrong with any vascular issues in my brain. However, when I went for the CT calcium score as well, it actually came back that my calcium score was 0. Now, not knowing what that meant, Dr. Tang was able to give me the reassuring news that a calcium score of 0 is actually really good news. In hindsight, it was possibly the worst news that I could have been given, because it was almost a signal to me that I could carry on eating crisps, I could carry on eating chocolate, I could carry on not going to the gym and stuff. And so in many respects, that what should have been a wake-up call for many people was actually just a signal to me to carry on as you are, nothing to worry about. But because it's 2 years down the line, and I think things change in your life, things change in your metabolism, and because it's also World Heart Day, I thought, well, I've got to just have an update on where I am with this as well. So I went for another calcium score today. I'll get the results for that in a couple of days' time. Hopefully it will still be 0. But this time, I won't carry on eating crisps, I won't carry on eating chocolate digestives. I'll make sure that the fact that I spend 10 hours a week driving up and down from Glasgow to Manchester, I commit to exercising to the same amount to offset my lethargy. And my message to everyone else on World Heart Day would be to don't take your heart for granted. Make sure that you take a test, have a simple health screen. It might lead to nothing, but it might lead to something that's important for you.